Welcome to Spinal Moves, a Canadian series about activity-based therapy, an intervention used to improve recovery for people with spinal cord injury. I am your host, Hope Jervis-Rademeyer. In today's episode, I will speak with 3 people living with spinal cord injury about their experiences with ABT. Our first guest today is Chris Rice, age 27. Chris sustained an incomplete C7 spinal cord injury in 2012. He has been participating in ABT both at home and at a facility in Newmarket, Ontario since that time. He continues to see consistent progress in his recovery and is always seeking new treatment options. Chris recently went skydiving with a friend of his who is also a paraplegic. Welcome, Chris. So my first question for you is, how did you first learn about activity-based therapy?
I learned about that when I was laying in a hospital bed in Lyndhurst Rehab in Toronto. A guy walked in, or he didn't walk in, he rolled in. Around my age, he introduced himself as Scott, and he actually goes to a facility that's 10 minutes away from where I'd be living when I left the hospital, called Walk It Off. And he told me about what they do there, and that's basically where my introduction was.
I've actually read about a few of your feats, including dancing with your best friend on her wedding day and doing the edge walk on the CN Tower. Has ABT helped you with these accomplishments?
Oh, absolutely. The greatest thing I've ever done was that dance at the wedding. That's something, at the beginning of my injury, nobody thought it was possible. Without ABT work, without, the standing and squatting, obviously, I would have never been able to do that. So focusing on those muscles and trying to get them back just allowed me to do that and many of the other, kind of crazy out there things I've done over the past few years.
So can you tell me what made you decide to do that and maybe a little bit about your home setup?
Sure. Yeah. So the main reason, there's actually 2 main reasons. I moved home to Nova Scotia and there's not much as far as access to ABT here. There's a facility in Halifax, but that's 2 hours away from me. So that's prohibitive, and cost is the other thing. ABT is, just like most physiotherapy, is really expensive if you're going to do it for a long period of time. And I wanted to be able to kind of get back into a normal groove of life, start working and things like that. My setup at home, I have parallel bars. I have a lot of traditional gym equipment that you would use for lower body. I have a knee extension flexion machine. I have a leg press or a total gym, things like that. And then I also have upper body machines like cable machine and free weights.
I'm curious, how often do you do ABT in a week?
Yeah, my exercise program right now is generally 5 or 6 days a week. I kind of have 3 separate categories. One is ABT, lower body focus. The second would be upper body focus, traditional exercises. And then the third, I kind of blend both of them.
Our next guest on today's episode is Andrea Nelson. Andrea Nelson is a person living with an L1 incomplete injury. She is ambulatory and uses both a manual wheelchair and forearm crutches to get around. She was injured in 2017 in a skydiving accident and has been doing activity-based therapy consistently for the last 3 years. She loves being outside and staying active with activities like hiking, biking, and kayaking. So can you tell me a bit about how ABT has influenced maybe your ability to do these activities?
Regardless of your abilities, you can get out and do those things if you have the right adapted equipment. Though ABT has definitely helped me functionally regain a lot, and I'm able to walk again. So that's a big change for sure.
So ABT is quite an intense activity. So often it involves high reps and it really gets the heart rate going. What does your typical week of training look like with ABT?
It is different every week. I feel like that is one thing. Yes, it's a lot of work and it's hard work, but it just varies so much. And the trainers are so inventive with the exercises they have you do. I've done hundreds of different things, and it just depends on where I'm at in my progression that week. So just a lot of different things. We always focus on strength in some regard, but also balance and coordination. So there is that really physically challenging stuff, but then there's the mental component of maybe working on muscles that you don't have a connection to yet or that are super faint.
So how soon after an acute spinal cord injury do you think someone could start ABT?
I would say as soon as possible. Obviously, you're dealing with other stuff first, just learning how to sit up or having your scar heal or your surgery. heal properly. But as soon as you can do activity-based therapy, I think you should.
Our final guest today is my co-host, Anita Kaiser. Anita Kaiser is a scientific associate at the SCI Mobility Lab at Kite Toronto Rehab, University Health Network. Anita is also the Director of Research for the Canadian Spinal Research Organization. Her research specializes in the development of tools to track participation and performance for individuals engaged in activity-based therapy. In her spare time, Anita models for Izzy Camilleri's IZ adaptive clothing. Welcome, Anita.
How has ABT affected your spinal injury presentation?
Sure. So I definitely noticed a few changes for me. So I think the biggest thing I'll say is I obviously don't do any upper extremity fine dexterity functions. So I haven't noticed huge gains for me in terms of being more independent in my activities of daily living. But with the core strengthening that I've been doing, it's actually helped me to sit up straighter. So I've actually made adjustments to my wheelchair to sit up straighter, so I'm not as reclined. And that's actually helped reduce a lot of the neck and shoulder pain that I've had. So that's been really great. I've also neurologically strengthened my triceps. So I think my triceps originally scored around a 1 or 2, and now they're up close to a 4. So it's significantly helped my transfers as well. The other thing that I've noticed too is some sensation changes. So I've noticed temperature sensations, not surface sensation below level injury, but for example, if I put like a hot plate on my lap, I'll feel heat deep inside below the surface of my skin, so deep in the tissue. And I can also sense cold deep in the tissue. And I also get a bit of a proprioceptive sensation of where my limbs are in space. And I can also feel like deep pressure below level injury, not everywhere, but like definitely in my core area. I can feel it in my back and I think around my abdominal areas as well. Definitely feel the soreness after a workout below level of injury. So that's been some interesting and exciting gains. You know, what's unique about it is basically 20 years ago when I was in rehab, it was very much conventional rehab where the focus was on strengthening the muscles that were innervated above my level of injury and passive stretching below, and then really just focusing on trying to be as independent as possible with my activities of daily living. But activity-based therapy is really focused on promoting recovery. So that was really sort of interesting and exciting.
I was wondering if you can tell us a bit more about your approach to ABT exercises.
So I did focus a lot of my exercises on strengthening the core area, and then some exercises that are kind of focused on lower extremity activation. So I split up my 3 hours into like kind of 3 sections where I spent the first hour working on standing and then standing related activities as I started things like sit to stands and body weight support treadmill training. So then my next kind of 90 minutes or so was more focused on floor related exercises. So that would include things like high kneeling and then sort of all the different stages that led towards crawling. And I also did a lot of supplemental exercises at that time too. So some of the exercises just involved sort of increasing my upper body strength because I needed that in order to do some of these activity-based movements, right? And then the last 30 minutes of each of my sessions was devoted to a piece of equipment. So I usually rotated between the spin bike or the new step or the adductor. So that was kind of like more or less my whole workout program. It was really fatiguing, both mentally and physically, because especially with those targeted exercises below level injury, it involved a lot of motivated mental effort. And then obviously the exercises themselves involved a lot of repetitions. By the time you're done the 3 hours, you're wiped out.
So what is it about ABT that inspired you to take it from a therapy that you do to developing an ABT measurement?
So as I was participating in ABT and as I was seeing the improvements I was making, it actually got me really excited. And so all these different questions started popping up in my mind. So, I kept thinking about, well, if I'm making these improvements, are other people's spinal cord injuries getting the same result? How would level and severity and time post-injury affect outcomes? What are those optimal dosage and timings to get those results? And I knew that in order to get some of this information, you really need tools to be able to collect that data. And I knew that there were no standardized measurement tools that were out there to do that. So that's how I got sort of interested in actually developing tools for this.
So if you could speak to therapists in Canada right now, and you are, what would you say to them about delivering ABT to their patients with spinal cord injury?
Oh, that's a great question. So I think, first of all, I would probably just say simply that one thing I've recognized over the years is that rehab really never ends. Really, I think you can keep going with rehab and consistently still see improvements. So something that people should consider, like once they leave, not to just stop and go on, but seek out either outpatient therapy or community-based clinics where you can continue to strengthen and hopefully improve yourself in whatever way you can. I think the other big things is for therapists is to recognize that people, regardless of their level, severity, and time post-injury, have a chance of making functional gains. So recognizing that and maximizing people's potential is important. And the other thing that I've recognized too, just through my own therapy, is for the most part, I don't use a lot of fancy, expensive equipment. I do a lot of my therapy just with very simple, low-tech devices. Creativity has definitely been a huge aspect of ABT. There's such a wide variety of exercises that can be incorporated into someone's therapy program. And then I think the last thing really is the mental health aspect. So what's really amazing about ABT is it gives people hope. Whereas people once thought that spinal cord injury meant that you're never going to walk again and there's no hope of recovery. Now it's giving you that opportunity that there is hope that you can make gains. There's a potential for everyone to make some sort of functional improvement. And so that hope for the future really helps people to cope with their present condition, especially for those individuals who've just recently been injured.
Thanks for watching episode 2, and be sure to watch the rest of the series.
For more information on the activity-based therapy community of practice, or to listen to the Spinal Moves podcast, log on to the website at www.praxisinstitute.org. You can also listen to Spinal Moves on Apple Podcasts, Spotify, or wherever you like to listen. Thanks to the Canadian Activity-Based Therapy Community of Practice, Praxis Spinal Cord Institute, and the ABT Video Committee.